Hello and welcome to the webinar Serving Those Aging with Long-Term Physical Disabilities During the COVID-19 Pandemic, Challenges, Successes, and Innovations. My name is Dr. Michelle Mead, and I have the privilege of being the PI and director of the Investigating Disability Factors and Promoting Environmental Access for Healthy Living, or IDEAL, Rehabilitation Research and Training Center for promoting healthy aging among adults with long-term physical disabilities. We are very fortunate that this webinar is part of our quarterly webinar series that has occurred throughout our grant cycle. The mission of the IDEAL RRTC is to understand and enhance healthy aging for people with long-term physical disabilities, especially those at risk for poorer outcomes because of a lack of resources, severity of disability, location, or other circumstances, through knowledge, training, and research, knowledge translation, and training activities. For more about the grant and our Center for Disability Health and Wellness here at University of Michigan, please go to our website, disabilityhealth.medicine.umich.edu. This webinar and the research activity is funded by a grant through the National Institute of Disability, Independent Living and Rehabilitation Research. Just a quick note to save a date for upcoming conversation on women's health and spinal cord injury to occur in March on the 9th at 6:30 p.m. With this presentation, we are so very fortunate to have Melissa Riba and Marissa Orska here to lead a conversation with community organizations. During this live presentation, please excuse any unexpected moments. We hope this doesn't happen, but though if the webinar were to close unexpectedly, please reopen it from the link that you used to attend this presentation. This webinar will be recorded, and a recording and slides will be available on our website after the webinar. We also welcome your questions. You can put those in the Q&A box attached to the browsing bar in your Zoom windows. We'll do our best to address all the questions at some time during today. Closed captioning is available to show or hide the transcript. Click the up arrow on the live transcript button. That is also part of your Zoom browser. For privacy during the presentations, all participants are in listen-only mode with microphones muted, and a chat between participants is unavailable. One last note, if you are posting to social media about what you learn here, please tag us and use the hashtags that will appear in a moment in the chat. And with that, I will move on and allow Melissa and Marissa to tell us the next steps.
Okay, yeah, thank you so much everyone for joining today. I'm going to share my screen. And sorry for the technical difficulties. Usually I have two monitors, and today I do not. Sorry, one second. I'm so sorry about that. So today, as Michelle mentioned, we'll be presenting research that and talking with organizations about serving those aging with long-term physical disabilities during the COVID-19 pandemic. This grew out of work that our organization, the Center for Health and Research Transformation, has been doing as part of the larger IDEAL Rehabilitation Research and Training Center research initiative with funding from NIDLR. And the goal of our presentation today is to really hear from organizations that are on the ground serving those aging with a physical disability about how the COVID-19 pandemic has had a lasting impact on the work that they do, in terms of challenges that they have faced, but also how they've reacted to those challenges and adapted and innovated in ways to continue to serve their clients. And so in terms of the structure of this webinar, first we'll begin by sharing findings from our national survey of organizations. And our goal with this is to really kind of give a high level look and view at challenges, adaptations, and successes that organizations have faced during the COVID-19 pandemic and in the aftermath of that. Then we'll turn it over to our panel of organizations who will share about the long-term impact that the pandemic has had on the work that they do. We'll be hearing from Lauren Glover, who's the Executive Director of the ARC Detroit in Michigan, John Gingrich, who's President and CEO of the League in Indiana, Deanna Jones, who's Executive Director of the Thompson Senior Center in Vermont, as well as Ash Lemons, Associate Director of the Ability Center in Ohio. And so first we'll dive in by looking at what we found in the survey. So a little bit about the survey that we conducted. Again, the survey was funded with funds from NIDLR, and the sample for the survey was organizations that are included in Michigan Medicine's National Resource Center for Aging with a Disability, which is a national database of organizations that serve those aging with a physical disability. Our online survey was distributed to 1,647 organizations through October 2021 through to May 2022. We heard back from 139 organizations, which is about an 8% response rate. And of those 139 organizations, 128 indicated that their organization serves those with long-term physical disabilities. And so that's kind of the focus of our survey today and our discussion of what we found. So just to kind of set the stage a little bit for, what the organizations looked like that we heard back from. There was a good amount of variety in terms of the size of organizations we heard back from. We did see that most of the organizations that responded were fairly established and had been operating for more than 10 years. And we actually didn't have any organizations respond that had been operating for less than 2 years. In terms of the geographic area that was served, we saw that most of the organizations served populations that were statewide or more local than that. But we did have some organizations represented that served multiple states or had a nationwide or international reach. In terms of the geographic distribution of participating organizations, we had organizations participate from, around the country. 19% of the organizations were from the Northeast census region. About 16% were from the Western census region. 30% were from the Southern census region, and 35% were from the Midwest region. And as you can see from this visual, organizations from Michigan were more likely to respond to the survey, probably given they were more familiar with the University of Michigan. In terms of, we asked organizations about the services that they provided. The most common services that organizations reported providing were advocacy, provider education, social support and socialization, as well as physical activity related services. So to dive a little bit into the data, we asked organizations about challenges that they experienced during the COVID-19 pandemic. And in particular, we asked organizations, what has been the biggest challenge to your organization during the pandemic? And this was an open-ended question, so organizations were free to respond with whatever they saw as the biggest challenge for their organization. The most common challenge that organizations reported were program and service interruptions or loss of momentum due to having to pause, cut, or reduce services due to safety measures, declining demand for certain programs. And also, some organizations mentioned how they were affected by the COVID-19 impact on supply chains and things like that. The second most commonly reported barrier were challenges related to staffing. So organizations talked about having to lay off staff as a result of the pandemic, difficulty recruiting and retaining staff as a result of the pandemic, but also staff burnout resulting from the pandemic. Organizations described challenges associated with switching to virtual programming and operations for both clients and for their staff. They described some challenges maintaining safe in-person services and switching those services so that they could be conducted safely, describing some challenges and confusion related to informing clients and families about COVID-19 protocol and also keeping staff safe. Organizations also describe challenges associated with greater need for their clients and families. A lot described how their clients and families were experiencing social isolation or setbacks in terms of their physical abilities due to kind of interruptions of programming and things like that. And so one of their challenges was trying to adapt to meet that need. Organizations describe funding as a challenge. And some organizations also describe challenges relating to having to find other ways to do outreach compared to how they had traditionally been doing outreach. And, as we noted, one of the biggest barriers that we saw was organizations reporting that they had to interrupt or cut back on programming. We saw that about half of organizations reported that they had to kind of change or cut back on existing services as a direct result of the pandemic. Some of the themes we saw here was that organizations described having to switch from in-person programming or cut in-person programming and change to more virtual programming or adopting more contactless methods of service delivery. Organizations described having to cancel in-person events like sporting events, fundraisers, dances. They described having to cut back on services due to limited staffing, less demand or participation, and also being able to abide by safety protocol. And some organizations reported having to offer fewer group activities. In addition to asking organizations what their biggest challenge was as a result of the pandemic, we also asked organizations generally about what some of their biggest challenges were related to serving clients that are aging with a physical disability. And just to orient you a little bit to this visual, the percentages that you see on the side are the percent of organizations that reported this item as a challenge. And the part in brown represents those that reported it as a small challenge. The part in green yellow are those that reported as a moderate challenge. And in blue, you see those that reported that item as a significant challenge. And so as we can see here, organizations were most likely to report financial resources and staffing both as challenges, but also as significant challenges. And we also saw that a large share of organizations reported transportation assistance as a significant challenge for their organization. And so, given that financial resources was one of the most commonly raised challenges, in fact, 37% of the organizations reported lack of or insufficient financial resources as a significant challenge for their organization. And so we dug into the data to see, how COVID-19 may have exacerbated this for organizations. And 23% of organizations reported decreased funding as a result of the COVID-19 pandemic. And even for those organizations that reported that their funding remained the same or about the same, we saw that organizations still reported challenges given that they had the same level of funding, but were trying to meet kind of a growing need. And so the challenges involved with trying to make funds stretch farther and things like that. We also saw, so about half of the organizations reported that they received new or more funding that was specifically related to COVID-19. And we had a couple of organizations talk about challenges related to that funding drying up and having to make some difficult decisions about what programs and services to keep and how to operate moving forward without that COVID-19 related funding. So to switch gears a little bit, a lot of the organizations described challenges that they faced as a result of the pandemic. But we also saw that a lot of the organizations were really successfully able to adapt and innovate in the face of these challenges. And so, one of the things we asked organizations is, what would you consider to be organizational successes during the COVID-19 pandemic? And again, this was an open-ended question, so organizations could respond however they wanted. The most common response that we saw was organizations were proud of their COVID-19 response. Organizations also described being proud of how they were able to develop and implement virtual services and operations. Organizations described that they were proud of the resilience that their organization showed during this time and being able to continue to operate and serve clients. Organizations described how they were proud of being able to expand to meet the growing needs and evolving needs of their clients. And organizations also talked about innovation that happened for themselves as an organization during this time and how they were proud of those changes. And one thing that stood out from us to us from the data as well is that 60% of organizations that we surveyed indicated that they had added new services as a direct result of the COVID-19 pandemic. And so, for those organizations that had said that they added services, we asked, what types of services did you add? And the most common types of services that we saw that organizations added was they described new modes of service delivery. And oftentimes these were ways of, providing social support and social activities virtually. Organizations described offering virtual education and virtual training. And organizations also described, leveraging technology to be able to care and treat their clients in ways that they hadn't before. Organizations also described new programs and services that they added as part of their COVID-19 response. So they described, programs related to vaccination outreach and education, services that they offered to improve access to vaccines, things like transportation and in-home vaccination services. They described programs to help try to meet basic needs for their clients. So these were, as part of the pandemic, organizations described that for many of their clients, there were kind of exacerbated needs related to food, to housing, to financial support and benefits. And so they described, things like, online food ordering programs that they initiated, curbside or home delivery for food related assistance. Things like benefits assistance, particularly related to benefits, related to the pandemic, rapid rehousing programs, housing related legal assistance, and other programs aimed at kind of meeting these needs for their patient or for their clients. And also some organizations described that they added or further supplemented their caregiver supports. By adding things like virtual caregiving support groups, virtual webinars and trainings tailored specifically for caregivers. And so overall, we saw a lot of organizations adapting and adding services to kind of support their clients and their families. As I mentioned, one of the things that stood out to us is that a lot of organizations really took advantage of the pandemic and the time they had to take a step back and really think about how they operated as an organization. So, a number of organizations talked about how they engaged in strategic planning at this time, and talked about what they wanted the future of their organization to look like and how they might need to make adjustments in terms of the resources that they had and how they were allocated. Organizations talked about how the pandemic really encouraged them to take a step back and reconsider how they provide services and to make process improvements. And also organizations described that the pandemic really kind of encouraged them and was an opportunity to make new partnerships, but also strengthen existing partnerships to be able to kind of be flexible and be able to meet the needs of their clients. And so those were, the major highlights and findings from the survey. I'm now going to turn it over to my colleague, Melissa Reba, who will be moderating our panel.
Yeah. All right. Good afternoon, everybody, and welcome. I want to especially extend a welcome to our panelists who agreed to join us today and share their experiences. One of the reasons we wanted to have this panel here today is because we want to bring a human face to these results that we, conducted. We have, we're talking at a, relatively high level, aggregate level with our survey results, but we wanted to also sort of put that human touch on this. And these folks all represent organizations that are on the ground, working through these challenges and successes that we've been describing here. So with that, let's welcome our panel. We've already briefly introduced everybody, but I think what I'll do is ask each one in turn to, again, reintroduce yourself and tell us a little bit, very briefly about your organization and the populations you serve, the services you provide. And then we'll launch into our discussion. I think just for the sake of sort of managing the discussion, I think I'll just call each of you in order and we'll go from there. So why don't we start with Lauren and have you open this up?
Hi, thanks for having me. My name is Lauren Glover. I'm Executive Director of ARC Detroit. The ARC Detroit services people with intellectual and developmental disabilities throughout their lifetime. So we have, children and we have aging adults. Our aging adult population, they've been with us for years. We have a art program that's twice a week. Some of those participants are aging adults with physical disabilities. Like some of our people have cerebral palsy. along with an intellectual disability. And some of them have common abilities, just with the aging process, have developed physical disabilities. So I'm glad you're having this. We had many challenges over the COVID pandemic. Right now, we're getting back into our full in-person services we did prior to the pandemic. So thank you for having me.
Great, thank you. John, how about if we hear from you next?
Sure, thanks for having me. My name is John Ginrich. I'm the president and CEO of the League in Fort Wayne, Indiana. So we are the federally funded Center for Independent Living that serves Northeast Indiana, which is an 11-county geographic range. We've been serving people with any significant disability, any significant disability in that area since 1981. But our history actually goes back to 1950 when Helen Keller came to Fort Wayne and actually raised money to start the organization. We too saw some challenges during the pandemic, not only with being able to provide direct services to our consumers, but it also, you talk about those staffing levels, particularly as the pandemic went on and on and on. So we pivoted in how we did some stuff, and I look forward to the rest of the discussion today.
Perfect. Thank you, John. All right, next let's hear from Deanna.
Hi, I'm Deanna Jones, and I'm the Executive Director for the Thompson Senior Center in Woodstock, Vermont, and we are a pretty rural area. We're a multi-purpose senior center that has robust nutrition program, transportation, aging at home support services, including medical equipment and some home repairs. And we do lots of social activities and community engagement work as well.
Great, thank you. All right, and now finally, Ash, let's hear from you.
Hi, thanks for having me today. I'm Ash Lemons. I'm the Associate Director at the Ability Center of Greater Toledo. We serve primarily 7 counties in Northwest Ohio, and we also touch most of the contiguous counties. We've been around since 1920, started by the Toledo Rotary, and we advocate, educate, partner, and provide services and supports for people with disabilities. And the main goal is to create opportunities for people and to create the most disability-friendly community in the country.
Thank you so much. Yeah, it's amazing to hear the histories of the organizations you represent as well, and the longevity, that really speaks to the need and the continuing contributions that your organizations make to your communities. It's really it's humbling to hear this. So why don't we start with our set of questions, and so I'll sort of reverse the order now and just start with you, Ash. We just wanted to hear, since we just talked about and went over our survey results, and I think all of you responded to our survey. So I was just curious, is there anything in there that resonated with you about what we found, any surprises also? So Ash, why don't you give us some thoughts about that maybe?
It's really interesting. The survey basically summed up everything we experienced. I don't think there's anything on there that we didn't experience during those times. I think what stood out to me is that innovation becomes a necessity in times like that. And it provided us a lot of opportunities to create new processes and improve our partnerships with people. Yeah,
that's great. Thank you. How about you, Deanna? What anything stood out from the survey for you?
I agree. It seemed right on for all the things that we experienced and how we evolved through the last few years. I think it did resonate with me that, technology was so important, and I think we'll probably talk more about that too, but also the financial resources. I think that in my experience, at least working with the network of senior centers here, it was really varied too. Some folks, had additional financial resources that they had to use, and now they're, figuring out how to use to function without those or with fewer funds. And then others really struggled to find and get access to those financial resources depending on, where you were working. So that was interesting to me, that what those answers were.
Great. All right. Thank you. And John, how about you? Thoughts about these results?
I got to echo what's been said so far. Not a lot of surprises
Yeah.
because we experienced a lot of this. What we didn't experience, thankfully, was we didn't experience a lack of funding. What we experienced was, and I think probably a few others on here agree, we experienced funding that became, while it was given to us, it was outrageously or incredibly restricted on what we could do with it. And knowing that it's temporary funding, I mean, well, yes, every grant you get or every donation you get is temporary funding. When you know it's restricted funding for specific purposes, you really have to think through what you're going to do with it. So for us, there was some significant investment in technology, which I know I agree with Deanna. We made as well. I was relatively new to this role within the organization, just over a year. And when we had to make that tough decision in Indiana to send everybody home that could work from home, and that's in our organization, we're about 50 people. We still had 20 plus people in the field because of the jobs they do, because they're either in people's homes as doing home care services, or they were sign language interpreters going into the most severe settings of hospitals. But all those folks that we could send home, all of our advocates that we could send home, and our finance team and our fundraising team, 25 plus people, only to find out we only had 6 laptops. That was a challenge to fix early on, and thankfully we did, because it has benefited us beyond the pandemic. I'm an example today. I had a surgery on my knee 2 weeks ago, and haven't saw my office for the first time since the beginning of January 2 days ago. And I've been able to work every day because of what happened during the pandemic. So we did a lot of shifting of how we did things. We were fortunate not to have to lay anybody off. And it made us think creatively. We own our building and had a part-time janitorial staff person. And the deal we made was, we have lots of things that need shredded. I will bring you a paper shredder to your house, and I will drop off boxes every week. And I will keep you employed. So we didn't lay anybody off, which was amazing compared to some of our peer organizations within Northeast Indiana. We were fortunate enough for that, but it's definitely been an interesting time.
Yeah, that's for sure. I think of the saying, may you live in uninteresting times. It's like, there's a lot of that, I think, going around. So great. Thank you. All right. And finally, Lauren, what stood out to you from these results?
Many things stood out. I'm glad to see that we weren't alone. Seeing the survey, some of the stuff that they did, we did. Sometimes I felt like during the pandemic became a COVID response center for people with disabilities, because we were like distributing masks and advocating for vaccines for people with disabilities. We have a significant number of people with cerebral palsy who are aging, who could not get out and get the vaccines. So we partnered with the City of Detroit Office of Disability Affairs, and we put our people on we did one of the only cities in the country that did this, put people with disabilities on a priority list. And also we had them get their vaccinations at home, both vaccinations at home. We didn't get a lot of resistance from our disability community. But one of the biggest challenges was technology, because we all had desktops. We also didn't have laptops to take home. A lot of our people we served did not have any technology. They had, phones, just about it. A lot of the group homes, they didn't have a desktop. So it's hard. So we were always communicate with them, even before the pandemic, snail mail. And so when the pandemic hit, we had no way to communicate with us unless by phone. And people couldn't do their in-person visits or telehealth or whatever because of the lack of technology on that end. So we had to catch that end up with, or I could say, but maybe like the rest of the world, because the world was like switching over to technology, virtual everything during this pandemic. So that was, well, the survey made me feel that we weren't alone. Everybody was like pretty much going through the same thing.
Oh, thank you. Yeah, and I have to say, as a survey researcher, it's to hear you all say, you know, to basically validate these results is a big like phew from my side, because one of the most nervous things is when you present your results back to your audience, and you know, there's always that fear that someone says, well, that's not our experience at all. So it's nice, I mean, not nice to hear, because this is it's not nice, but it's validating to hear, you know, that we captured that, and you know, we reflected the experiences. So that's great. So you guys all highlighted challenges already, but let's dig a little more into that specifically. And certainly Marissa presented, you know, the challenges kind of overall. But, you know, let's have an opportunity to hear a little more deeply about the challenges you face. And so why don't we ask Deanna to start with that one?
Sure. Thank you. And I was so honored to be asked to participate this. And I think I might be a little bit of an outlier that, you know, we're not serving many counties. We're serving, you know, we serve about 1,700 individuals in a pretty rural area with Meals on Wheels and transportation, things that I mentioned. But, you know, and it's, sometimes that makes it feel like we're sort of a little island on our own. We really had to search for resources initially, especially just to have the capacity with the staff that I have. Our staff didn't get to go work from home really at all. We tried to stagger each other's schedules so that we would always have healthy staff at different parts of the building. But just the capacity, you know, Meals on Wheels more than doubled almost overnight. And the capacity to keep up with all of those essential services and still stay connected with people at home. You know, it was easier for us really when we had 120 people coming through the doors every day to check on them and see how they were and interact and stay socially connected. And we had to really convert that you know, to how we could support people at home. And so we began delivering prescriptions and picking up groceries and taking grocery lists and figuring out how to pay for those and get reimbursed, or go to the food shelf and, you know, partner with community organizations. So initially it was just that capacity and how to do it and how to fund it very quickly before any emergency funding came along. But ongoing, I would say our challenge, you know, shifted really related to technology, creating safe environments for people to come back together in small groups or one-on-one for things like taxes that we do and insurance support and that kind of thing. And then just really helping people adapt to getting their information technology wise. You know, those were huge challenges in an area where a lot of places people don't have internet or computers, and how to access that information or even sign up for a COVID vaccine, that kind of thing, when it was all technology based.
Yeah, that's great. Yeah, that's impressive. I think, you know, that is a very common theme, the increase in needs of certain programs or services without necessarily the increase in the staffing or the resources. And so I'm continually amazed when I hear about organizations and the work they've done throughout the pandemic, doing more with at least the same, but in many cases even less, right? And so it's, you know, really impressive, and it really speaks to, you know, the work that you all in your organization did. That's fantastic. Let's next hear from Ash. How about challenges and, you know, kind of what your organization faced?
We experienced similar challenges initially with kind of reviewing all of our programming and trying to determine how do we continue to do this with social distancing measures and keeping everyone safe. That was like the initial challenge in the first week. We had a stay-at-home order, I believe it was in mid-March from the governor. And so we were immediately looking at every program that we did and how can we continue to do it. I think through that, we kind of became innovative. We've created some processes that are actually more efficient and better connected with other organizations. Part of it made us more cognizant of what our constituents' true needs were. You know, we kind of, there are a few things that we did have to stop doing, but We backfilled those with things that we didn't do before, like delivering COVID care kits and sourcing masks and sanitizer, and doing a lot of advocacy and policy work with our local health department and governor. And so we found a way to be relevant, I think. I think the only lasting challenge that seems to be the biggest elephant in the room is the impact on the direct care workforce. And so there's a huge shortage that continues to increase. And so that's what our advocacy folks are, that's the target right now, is how do we help that moving forward? Because if we have to find a solution for the direct care workforce, or people lose independence.
Yeah, no, that's very true. And the issue of staffing shortages is, I think that's across the board, the thing that we hear, regardless of program or organization or sector or populations. It's a real crisis. I mean, and so, yeah, absolutely, 100%. We need to start thinking about, especially with direct care, how to bolster that so services can continue to be provided to those who need it. Great. All right. Lauren, how about you? You had mentioned a minute ago technology as some of the challenges, I think, but let's hear more about your perspective on the challenges that you all faced.
I have to ditto what Ash was talking about, the direct care, keeping direct care people in the home or doing the direct care services for the people that they serve. What we did in Michigan, we did a lot of advocacy for direct care workers. We got them a raise, and there was a temporary raise that was, that started maybe in April or July and then supposed to end in September of 2020. Well, we got extended. Eventually we made it permanent. A lot of our stuff that we do is like in person. So we had to learn how to pivot and go and start using technology. A lot, like I said earlier, the technology was not, people just didn't use that technology. I think there was a digital divide in certain areas of Detroit where people did not have access to the internet because there was no internet service in that area. So we had to catch up in that department. Well, we had to wait for the world to catch up in that department for us to access those services. But that came relatively quickly. They did have some opportunities for people to get free or low cost internet services, like a lot of our people on fixed incomes. And that's what they get, and that's what they get. And so we had to learn how to pivot. We did a lot of pivoting, and I think our biggest challenge was we had to learn how to pivot, and we found out that we could pivot.
Yeah, yes, you did. Yeah, we hear the word pivot and innovate quite a bit in these conversations. So definitely, you're not alone. Your organization is not alone. As we saw in the survey, but also with what we're hearing from our panelists today. So great. All right. How about John? Thoughts on the challenges that your organization faced?
Sure. So it varied by our programs. We have 14 programs and services throughout our organization. And a big one for our youth services program. What it typically does is get 70 kids with disabilities into typical recreation programs every summer. And there was a sudden halt on that. And that halt, wasn't just 1 year. It was a complete halt 1 year, and then a partial rebuild the next year, and a partial rebuild this last year. It is still rebuilding as organizations, our partner organizations try to figure out how they're going to continue to operate. So we saw that, and we saw a shift to more basic needs and crisis issues than, as a Center for Independent Living, we are very driven by our consumers. Our consumer sets a goal, and we help them in the best way that we can figure out how to help them achieve their goal. When the pandemic hit, we kind of had to reverse those roles a little bit, where we were calling our consumers every week, 2 weeks, 3 weeks, just to check in. Hey, how you doing? What's going on? What do you need? Because we were shifting how we were doing things, and they didn't think of us in doing those ways. They're those things.
Right.
So, we teamed up with a food bank and and with a local transportation provider to provide food delivery for people who weren't seniors, but were stuck in their homes due to either transportation issues or due to not wanting to get out into the community because of COVID. So we were able to create a new program and then try to find ways to sustain that program after it happened. It's not, it's not our program, it's a collaborative program of 3 organizations. And it was helping people continue to do the things that are important to them. Our peer support groups went online. And, first they started off as phone calls, and then it was the wonderful world of Zoom. And then it was Facebook Live groups, or Facebook groups. And it's interesting, one of our former consumers who had moved out of the country to the Ukraine was suddenly during the pandemic joining a support group, one of our support groups again, because I can get online and I can participate, which was kind of cool. Gave us an international flair. But then there was that, the number one way we can all advocate is the ability to vote. And we had an election during a pandemic, and it was, how do we help people? So we teamed up with a transportation provider and provided one-on-one transportation to get people to the polls early, so they didn't have to wait in long lines. So they weren't standing in line 2 feet behind somebody else or out in the cold, 6 feet behind somebody else. They could get in, get their vote done, and get back out. It was keeping up those things that we all think should just be easy, that suddenly became a challenge.
Great. All right. So let's see. Oops, can I not? There we go. Sorry, little glitch. Oh, there we go. All right. So I want to pivot. I'm keeping an eye on the time, and we're having such a robust discussion. We're going to run out of time before we run out of ideas and discussion topics. But I did want to talk about and really focus on accomplishments and what you're most proud of. Again, we heard some of those kind of aggregate from the survey. One of the things I'm hearing, as I mentioned before, we're hearing a lot of ways that organizations innovated or pivoted. Pivot is sort of the phrase for the day, I think. And so I'd be curious, I'll sort of do this as a sort of a twofold question to combine a subsequent question. What are you most proud of? What's your accomplishment? But then also, how do you see being able to sustain that and keep that momentum going forward, right? So let's start with Ash on this one.
Okay. I had a lot, so I won't mention it, but this one, I think for all of us, I've heard a lot. I think Lauren, John, Deanna, they've all said things that are in this paragraph that I've written for response for this kind of question. And it's all about the things that we did. But when I guess if I were to sum it up, we started to think more holistically about listening to our consumers and working with some instruments that will help us draw out what the needs are most when people call in, and we use social determinants of health questions to help guide that conversation. But if I look at anything, again, it is our ability to be able to work together to meet the current needs of people. But we did a zillion different things. The vaccinations, getting people to vaccination sites. We helped write guidelines for visitation at hospitals that 36 hospitals adopted. Social distancing at venues. We wrote pieces for the community, the city, restaurants. We got COVID kits to hundreds of people. The free cable and internet, we were a part of that. It seems like each community must have went there. We did find that early on. There were communities that were without, and we needed to address that. That was a huge inequity that we were able to work on. The technology, I can say it took a half hour the first time we all got on Zoom. We have 55 staff. I think we were a half hour in by the time we were all like, oh, we're on. But
Yeah.
we're very much pros nowadays. So
Yeah,
a lot of good stuff.
yeah, yeah. I think in our own ways, we're all sort of Zoom pros, right? I mean, 4 years ago, I don't even think I heard of Zoom, or I don't even know if Zoom existed, right? And now, it's kind of normative. So yeah, for sure. That's great. Lauren, how about you? What would you describe as, what you're most proud of for your organization, and how do you see being able to sustain that, going into the future?
Well, I think what we're most proud of is we're advocacy group already, but we did a lot of advocacy stuff related to the vaccine distribution, a lot of advocacy stuff related to who will get the ventilator. This is a big thing that was going out early in COVID, that the disability community was afraid of, or the people who are seniors were afraid of. We might not get a ventilator because we don't have, because we're late stage in life, or we have disability, and we might not get the ventilator. Somebody else would, because they thought they would be rationing ventilators and rationing care, but we turned that around. Also, working with the City of Detroit Health Department and getting vaccinations to people. A lot of our people were homebound, like people with cerebral palsy who were aging. They could not physically get out without a lot of help. Somebody would have to help them, be very close to them, and getting the vaccinations to them in their home, and getting our people with disabilities on our priority list, so they wouldn't have to go through that. Early in the pandemic, you had to make an appointment, all that fun stuff. A lot of that stuff wasn't going to happen with our population. So getting them on the priority list, I think that we're most proud of that. Also, getting them the masks that they need early in the pandemic. A lot of our group homes didn't have masks. A lot of our people who lived independently, but had supports coming in, didn't have masks. So we worked with Detroit Integrated Health Network, their staff, and we were physically making masks because there was mask shortage at the beginning. People were putting paper towel around their face, So we got that out, and the volunteers, we mobilized volunteers to get food out to people, mobilized volunteers to get masks out to people, and that's what I'm most proud of.
That's wonderful. Yeah, I remember. It seems like a distant memory, but not too long, that there were such shortages.
Right.
That people were making. I mean, I remember, friends, having a little cottage industry making masks because.
Right. Yeah. Yeah.
We had such shortages. So yeah, that's amazing. Great. All right. How about Deanna? What are you proudest of in terms of accomplishments, and how do you see maybe sustaining that?
Sure. Well, I'm so proud of love my staff and the volunteers that we've worked with. I mean, I just think the connections that all of us and kept with the personal connections with our participants. I mean, we really know the people we serve, and we went, day and night, really, making sure that they were safe and happy at home. For people that didn't have tech, I think we were as innovative as we could be with conference call-in numbers that they didn't, we set up a line, they didn't even have to put in a passcode to navigate. And so we did coffee chats weekly to stay in touch, and that let us know, we identified scams that people were falling for, and concerns about vaccinations, and so many things in those informal social connection times that people really needed to talk about. And we did phone bingo for people that didn't have tech through that same phone number. And some of that has continued because there's people that are really homebound on Meals on Wheels that couldn't get out and haven't been able to come back, but they're still participating on the phone. So I think the second part of the question that you asked, the lasting impact is it's hybrid and it's here to stay. And we've really improved our technology and support for that. And I'll close, and this is really talks about the accomplishment. In my mind, a quote from one of our participants who was 93 and had been home for 250 days and said, "The people calling in are the only riches I have left. They recognize you're a human being." And I mean, that just sort of sums it up to me.
Yeah, yeah. Oh, that's amazing. That I'm trying not to tear up at that. That's amazing. Yeah, and it's an important, important face to what you all are doing. So thank you for sharing that. All right, John, why don't you close us out with what you're most proudest of?
I am so afraid to follow that quote because that's amazing.
Right.
First of all, Ash and Lauren are giving me flashbacks to all the PPE kits that we put together, and there's 600 plus bags of stuff that our team was putting together and getting distributed. I think about that. I think about the partnership we made with a local distillery to get the hand sanitizer. I might have been a customer before that, but the fact that it was, we suddenly had 15 gallons of hand sanitizer in a matter of 2 days when nobody else could get hand sanitizer. But what I'm most proud of was our ability to get people out of nursing homes and keep people out of nursing homes. This was the scariest place to be if you were thinking about getting COVID. And even when it was tough to get in the door, our advocates were helping get people out of nursing homes. We were helping keep people out of nursing homes. We were using some CARES Act dollars that we had to do that. And what we've been able to do is show that, hey, we can do this, and then go after private funding to do some of those same things. Because while there may be other government funding out there, the private funding that we can garner here locally to help get somebody's rent established or their utilities established or get a ramp in their home so they can stay there. We were able to show we did this for 1.5 years, but that money's going away, right? Now it's gone. Help us do that, and we'll help you show improvements in housing stability in our community. So that's what I'm most proud of, is the fact that we were able to take what we did and continue it on in a much smaller scale, but we're still doing it.
Fantastic. Thank you. And thank you, all of you, for, being here today and sharing your experiences. We really appreciate it. We are at time, unfortunately. So, Michelle, I don't know if we've got a lot of questions, but maybe we could address those in writing. If that's okay, we can follow up.
That would be great. And once again, I would like to add my thanks. It's really illuminating. And thank you all for your willingness to be there. I mean, obviously what you do speaks to a dedication, a caring of the community, and a willingness to do whatever it takes to make a difference. From the part of the U of M Ideal RRTC and Center for Disability Health and Wellness, we want to just really help you identify and keep showing these best practices. The change and the interventions that work happen in the community. Research and researchers, I think, can help you illuminate those, can help you track those, and maybe get additional funding. And so let's keep, exploring partnerships with us, with other people around the country. But you kept people going. Thank you.
Absolutely. Yeah, it's fantastic. So thank you all. It's been a delightful conversation, and I can't thank you enough. I think we're good.
Yep.
Thank you.
All right. Thanks, everybody. Have a great day.